Welcome to Keep You 100 Radio. I'm your host, Lissy Pointer, type 1 diabetic, certified health coach, personal trainer, and founder of Needles and Spoons Health and Wellness. Inside this podcast, you'll find the real and raw conversations around diabetes management, including the lessons that we don't learn in our endo's office, my best tips and trainings, and conversations from the experts that I trust inside the community so that you can create more predictability in your diabetes management and feel empowered while doing so. Let's dive in. I love using Skin because honestly it's the only patch company that I found that actually keeps my devices on while I'm doing things that I love, like weightlifting, running with my dogs, being really active and doing the things that I didn't think I could do before with diabetes. Hello, welcome back to another episode of Keep You 100 Radio. I am here with my good friend. I can't wait looking right at you.
You're looking into my soul.
Yes. I am here with my close friend and fellow type 1 diabetic, Amanda Siprich. She is a registered dietitian. You may know her on Instagram as T1D Nutritionist. And we are lucky enough to both live in New Jersey, about 20 minutes away from each other. So you've probably heard her on the podcast before. We've talked about everything from pizza to Starbucks, and this episode I really wanted to dive into a common question that I ask you a lot, Amanda, because I think every time I get my blood work, I probably send you the results. I'm like, hey, can you help me interpret this? Because it's really scary seeing like a red underline or the letter H of like hi. And like, I think one of the goals that I have for this podcast is for people to feel empowered by their diabetes management, and part of that is being able to read their data as far as their blood sugar data, but I think along with that goes to being empowered in reading things like lab results that you get from your blood work at every endocrinologist appointment. So that's kind of like the premise behind this episode, which I'm really excited about. But before we get into it, do you mind introducing yourself and sharing a little bit more about you?
So I'm Amanda, also known as T1D Nutritionist online, and I've been a registered dietitian for about 5 years now. So as a registered dietitian, I've gone to school, done all the things, so I am able to read and interpret lab work. I'm also living with type 1 diabetes, so I know the common labs that are taken and why they're taken as well. So I think it's a really important conversation that we're having, and I'm excited to dive on in.
Yes. So, all right, number one question is, how often should we be getting blood work as people with type 1 diabetes?
It depends on every person individually. Those who are newly diagnosed likely are going to be getting their blood work taken a bit more frequently than those who are maybe more seniored or are meeting their care goals. But the frequency could really depend on a number of things, whether it's your age, your health history, maybe if you're pregnant, trying to conceive, any other potential chronic conditions that may be going on or new chronic conditions that may be coming up. But I would say as a general baseline, between every 3 to 6 months, if not that, then at least annually.
Okay, that makes sense. I feel like when my endo says like, oh, we don't need to see you for 6 months, it's just like kind of that win of like, yes, I don't need to come back every quarter.
Yes.
What is the reason why we're getting these, like, this blood work done so frequently?
So it's not only to assess our diabetes. So when we get the blood work done, of course, they're usually going to check out your A1C, which is like your 3-month average of your blood sugars, to kind of set the tone and see where you're at with your management. But they also want to check these other health indicators for whether it's your heart health, kidneys, presence of other autoimmune conditions, to make sure that with diabetes we are at a higher risk for developing potential complications. So it's just keeping everything in check.
That makes sense. Mm-hmm. I feel like it's like at first I felt really like kind of scared of the blood work and what it could say, but now it's almost something empowering of saying, hey, like this is a preventive measure and we get to kind of look ahead and just, you know, keep on top of the health of everything. Mm-hmm. So I know that you mentioned that there are sometimes some other like autoimmune conditions that come up. Are there kind of like common ones that come up with type 1 diabetes and that are typically looked out for?
Yeah, so some of the autoimmune conditions are that usually come through like blood work would be thyroid conditions as well as celiac disease. Other potential chronic conditions could be like heart disease, kidney disease, and also looking at if we're doing like eye exams, looking at your eye health, your foot health, things like that are also important as well.
So pretty much everything.
Yes.
All right, so let's dive into kind of like the first, I guess you'd say like area category of blood work that's run, and that's typically for diabetes, right? So can you dive into kind of what those tests are and what they mean?
Yeah, so I mentioned just a little while ago, you're likely going to get your A1C tested. That's going to give you that 3-month average of where you are with your blood sugars. Typically, the gold standard, quote unquote, for A1C is about a 7 for most people. They'll also go off of like your time in range and other data, but they usually do check your A1C. The A1C can be off depending on a number of different things. It may be higher or lower than what your potential CGM numbers are reading because of the time the test was taken, the lab that has drawn it, any potential chronic conditions, if you're anemic, and other potential medications or chronic conditions can also alter that number as well. So I like to look at time and range personally because I think it gives a bit better of a picture of what's going on, but the A1C still has a place in management, especially for those who aren't able to wear a CGM. Another test that's usually taken for blood sugars is your fasting glucose. And to be honest, for type 1, I always think that this one is so silly because I get so stressed on the days that I'm getting my blood work done. So my fasting is always high, and it will be like 250 high in like big bold letters, and I would always be like, oh my god, oh my god, oh my god. But my endo is just like, listen, I know that you are fasting. I don't want to break my fast because for some tests you do have to fast. So then if I eat, because my blood sugar goes low, then I have to like reschedule it. And sometimes going to like a LabCorp or Quest, like that's where my insurance forces me to go. It can be really frustrating to try to figure out a day that fits your schedule to go for another fasting test. Right. So I don't think fasting glucose is like a hard or fast rule. If it's just for the time that we're getting that lab test done. If your fasting glucose is high every single day, that's definitely something to look into. But if it's because you're stressed out about blood work, it's anticipated. Right. It's anticipated.
And that makes sense too. Just like also we know that our blood sugar fluctuates so easily. It's that 250 that was there during the blood work could have been 150 in a half an hour. Like it just it moves so quickly.
Yep, definitely.
So A1C, fasting glucose, anything else that?
Not typically for diabetes. It's usually that, and then they'll look at your CGM or blood sugar logs.
Yeah, and I guess that just kind of goes with personal preference with the endo of, I guess, what they look at. My endo always looks at the GMI from the CGM just because she's like, you're wearing that all the time. Like, let's use that data. But I definitely think, time and range kind of takes a take on that.
Yeah.
All right, so then we have the second category that we kind of look at, and that is the heart disease component.
Yep. So heart disease tests usually include blood pressure, triglycerides, and cholesterol. So typically when you go to your doctor's appointment, they're almost always taking your vitals, which include your height, your weight, also your blood pressure, sometimes your heart rate, but usually your blood pressure. So the reason why they're monitoring those things is because with diabetes, it does put us at a higher risk for potential complications, including heart disease. So it's important to monitor them for potential early interventions. So for heart disease with blood pressure normal, blood pressure is between is like 120/80 is pretty standard. Total cholesterol below 200 is the goal. And then something that I think a lot of people will overlook is on top of your total cholesterol, you'll also see something called HDL and LDL cholesterol. So these are two different types of cholesterol that contribute to your total cholesterol. So I like to look at what that ratio of your cholesterol is. So for me, for example, my total cholesterol is always like exactly like 201, 204, like every single time.
So you're just on
I'm
the
like
cusp.
just there. However, when looking at my LDL and HDL cholesterol, my HDL is also known as your healthy cholesterol. My HDL cholesterol is usually really high.
Mm-hmm.
My LDL, which is your lousy cholesterol, is usually low.
I love that way of framing it because I always get them mixed up.
Yes. Healthy, H for healthy, L for lousy.
Perfect.
So, looking at those ratios, it makes me feel better that if my total cholesterol is right at that cusp, at least I know that what's contributing to it is the healthy cholesterol.
Right.
So it's something to consider. I've had doctors in the past want to put me on medications for cholesterol, and once I brought up that like my ratio was looking pretty good in my opinion, they were just like, okay, like let's consider holding off and seeing what that ratio continues to look like.
Okay.
So the other component of looking at heart is with your triglycerides. So all of these things can tell you how well your heart is pumping and moving and the blockage of any potential arteries and things like that. So any of these potentially being high and out of range can be indicative of a higher risk for cardiovascular health.
Okay.
So if any of those are high, before potentially getting on any medications for medication management, lifestyle changes such as diet and exercise are also really great ways to reduce those labs if possible.
Okay. At what point does the red flag kind of raise on those results?
I think it depends, because for a lot of people, these labs, it depends on why they're elevated. They can change rather quickly. Like if you're going through a stressful season of life where you haven't gone to the gym for 3 months and the closest thing you've had to a vegetable is probably French fries or maybe like lettuce and tomato on a burger, it would make sense that your cholesterol and your triglycerides may be towards the higher end. But if you were to make some of those lifestyle interventions, you may see improvement in those levels within the same amount of time. Right. So I think that it's important that, we also consider and really look at what our lifestyle is too, and be honest with our doctors and our care team because, medications are great, but we also want to look at to see what other things that we can be doing to potentially improve our health and overall well-being as well.
Yeah. And I think that's where it's important too to have a provider that's willing to get curious about those things rather than like jump to conclusions of just take this medication.
Right.
Yeah. My endo's really great about that. Because I've had a few times where my cholesterol has been higher, and she's like, okay, well, like you're pretty active, you eat relatively healthily, like what is the other component here that we might be missing? And then, every time that may have happened, we're like, okay, we'll check it out again in another 3 months, and then if it's still elevated, then we will look at other options. But she always gives me the chance to see like, is this a true pattern or is this a true like trend, and how can we mitigate it before jumping to that?
Absolutely. And just to go off of that, this is where working with a registered dietitian can come into really help as well, because we can do medical nutrition therapy to help people lower their cholesterol or lower their triglycerides as well. So if your doctor is less like, you need to get rid of X, Y, and Z, work with a dietitian. We'll put you on the right path for what you can do.
Can you do a quick definition of medical nutrition therapy for anybody who doesn't?
Yeah, so medical nutrition therapy is basically when you work with a dietitian to medically manage a health condition through the use of nutrition. So whether it's blood sugar management for diabetes, cholesterol management for high cholesterol, high blood pressure, any chronic conditions, dietitians will be doing or providing medical nutrition therapy. And it should be done with a registered dietitian because we are trained, we went to school for this, rather than, a personal trainer or coaches in the space. Anytime someone has a chronic condition and you're telling someone what to eat, it becomes medical nutrition therapy.
Yep. And that is where we talk about, we have this conversation all the time about like just the scope of practice with coaching. And we know that can get really confusing when, just looking at online marketing and just the online space. So I'm really glad that we went through that. So thank you for taking us through. All right. So next on our checklist is the kidneys. So that's something that we dive into a bit, right?
So your kidneys have a really important function. So they're like your body's filtration system. So we want to keep them nice and healthy. And again, with diabetes, it's another part that we're at risk for. So some common blood work values that can test your kidney function include your GFR, your BUN, and your ACR, or your albumin to creatinine ratio. So your GFR is how well your kidneys are removing any waste products and extra fluid out of the body. So a normal value is usually about 90. Again, this is going to vary based on gender, age, a lot of different things are going to vary with these numbers. Your BUN is the urea. I'm getting real sciencey for you guys.
No, I love it.
But it's the urea nitrogen that comes from the breakdown of protein in foods. So a normal BUN level is between 7 to 20. If your kidney function decreases, proteins can be really, really hard on the kidneys. So the amount of the harder the higher your BUN is, the harder your kidneys are going to have to work. So the higher that number is, the BUN will continue to rise.
Okay.
Yes.
Okay. I like that you're putting this into like simpler terms because again, like you look at these results and all of a sudden you just see a high number and you're like, I don't even know what that means. And then you go to Google and
it's like you're dying.
Right. Yeah. It's so overwhelming. I think I had one of these. I think I messaged you about one of these numbers being high in my results. And I Googled it.
I'm like, you're probably slightly dehydrated.
That's literally it. I was like, I have kidney disease on top of diabetes, and it can lead you down a rabbit hole. So thank you. Okay.
So the next one is your ACR, or your albumin to creatinine ratio. So this is a urine test. So normally if you go for your blood work, usually you'll also like pee in a cup. So some tests are done through blood and some are done through urine. And because your kidneys are in charge of removing all your waste products, it gets removed through your urine. So we also usually test urine to test our kidney function. Makes sense, right? So first part we have is the albumin, and that's the most common protein that's going to be found in your urine. Higher amounts of albumin in your urine can be a sign that your kidneys aren't working appropriately. And to get that ACR ratio, you're going to divide that amount of urine albumin by the amount of urine creatinine, which is just another waste product that is produced by our bodies. And typically below 30 is considered normal. So with these, anything that is trending upwards or getting higher can be a sign that our kidney function is slowly decreasing. But this is also normal with age. So if you think about it, our kidney function when we're like 30 years old is going to be very, very different when we're 60 or 90 years old as well. So if there is anything that you guys can take away from today, is that the best thing you can do is take these preventative measures by assessing them, because things can be acute. You can have acute kidney disease where, these labs are temporarily increased due to a number of different reasons. But we want to make sure that if it is acute, we're able to treat it before it becomes chronic and it doesn't go away. And we need either a medical intervention or dietary interventions as well, in hopes that if we're able to preserve that kidney function for as long as possible, if our kidneys stop working, your body's going to get a buildup of waste products inside. So if you're not able to excrete all of these wastes, that urea, nitrogen, all of these products are going to build up, and that's not good. We need to get rid of them.
Right.
So people may be required to go on dialysis, which is not pleasant at all. It's really time consuming. Quality of life is not great. So if we can decrease the risk of dialysis, that's definitely something to consider. And again, I don't want to scare people with this, but it can be a reality. And it's why it's so important for us to take these preventative measures to preserve this function for as long as we can.
Right. And that's why I love just the education behind these things, because again, like there's kind of the spectrum of looking at this and being really worried about complications and things that can come up, which it's scary to look at the different realities sometimes. But also there's the shift in mentality of, okay, I'm going to look at this in an empowered mindset and say, like, let's look at what this actually means about my body. Let's kind of like get one step ahead of it. So when you say preventative measures for specifically like the kidney side of things, what do those look like?
So it can be maintaining your blood pressure can also be really beneficial for your kidneys. Depending on other labs or maybe your health history, potentially modifying your diet can be beneficial. Like I mentioned, eating protein can be really hard on your kidneys. So if your labs are potentially showing a sign of decreased kidney function, again, working with a dietitian can be really beneficial. There's also certain nutrients that are really hard for the kidneys to process. So some people have to go on like a low phosphorus diet, low potassium diet. They have to take calcium blockers. So it's helpful to be aware. So again, we could make these adaptations as needed in order to preserve that function for as long as possible.
Right. Okay. I like it. All right. Next on our list is the thyroid. This one hits home mostly for me because after I was diagnosed with diabetes, my endo started testing more for thyroid disease. This runs a lot in my family. Like my dad's whole side of his family has thyroid disease. So she tested my antibodies, and I have I think I have both somehow. Like I have for like both Graves and what is the other one? Graves and hyper and hypo.
Yeah.
And so she's like, it's not if, it's when. So like every 3 months on the dot, I'm like getting these tested. So can you take us through what those tests look like?
So your thyroid is essentially the gland. It's like right here in your throat, but it's essentially in charge of regulating your metabolism. So if you've ever gone to the doctor and they kind of like touched around here, they're essentially touching your thyroid to see if it's enlarged. If your thyroid is potentially enlarged, it can be a sign that it's like overworking, kind of like a muscle. Like if you're working your muscles are going to grow. The same thing with the thyroid gland. If it's going to have to work really, really hard, it's going to get bigger. So with the thyroid conditions are typically autoimmune. So they will be looking for any discrepancies? Is that the word that I want?
Sounds right.
Any discrepancies with your labs for your thyroid. Typically, it's looking at the thyroid hormones that it's producing. So that's either your TSH, your T3, and your T4. There's some other like labs that can also test your thyroid function, but these are usually like the baseline basic ones. So these will essentially tell whether your body is producing too much, too little, or just enough. So your thyroid, once these numbers are detected, medication management, stress management, dietary interventions, all these things can also help with the management of your thyroid as well as your metabolism. And those interventions will really depend on whether it's hypothyroidism or hyperthyroidism, and what specific symptoms you're experiencing with your thyroid as well as your metabolism.
Do those numbers change frequently too? Like from personal experience, I've had times where my thyroid levels were too high, and I've also had them where they're too low. So she's like, we're just gonna see what they are next time.
To be honest, I have no idea. I really don't know.
That is okay.
Scratch that part out.
Yeah, that was a personal, like, I was honestly like, that's weird.
Yeah.
It was high, it was low, and
in my brain, the way that I think it would work would be like, if it's hyper, you would like trend like a little bit in one direction and not trend
like
the opposite direction. Right. Do you have a thyroid?
I do, yeah.
Okay. Because you're just like, wait a minute. Was I born without? Because I'm like, when you don't have one, like that's where like your hormones can get like real whacked out. But I'll have to look more into that.
We've been normal the past like year or so we're just waiting, but
that's good.
All right, so next on our list, we have probably one that's pretty, I think, common, would be more of the celiac.
So celiac disease is an autoimmune disorder. It's when your body has an autoimmune response to eating gluten. And again, with type 1 diabetes being often an autoimmune condition, our risk for developing other autoimmune conditions is increased. So again, a common test to screen for is celiac disease. So in order to test for this, similar to like testing for type 1, there's like autoantibodies. You can test for the presence of celiac disease through antibodies. If you're still having symptoms and you're not testing positive for the blood work, sometimes doing an endoscopy and a biopsy of the small intestine can also verify. It can be really difficult to get like an official diagnosis of celiac, but some of the antibody testings include IgA, IgG, and TTG. And so with those tests, what can be really frustrating for some people, especially if they're having a lot of GI distress, is that they must be eating gluten in order to detect that autoimmune response. So if you have an inkling that like you might have celiac disease and you go gluten-free and then you take this test, it's going to maybe give a false response, because if you're not eating it, you're not going to have that autoimmune response.
That makes sense.
But if you are eating it, and you may not feel the best, you may not have the best symptoms going on.
What do those symptoms usually look like?
So it can really differ. For some people, it's a lot of GI distress, and it can go both ways. It can be constipation or diarrhea. It can be a lot of bloating, gas, weight loss. Your stools could be like hard or soft, depending on, again, constipation or diarrhea. And there's a lot of other things that can be contributing to it, because if your body with celiac disease, it's usually the small intestine that's impacted. So if your small intestine is inflamed, so we're gonna get real sciencey here.
Let's do it.
So the small intestine has these like little fingerling little villi, and that's where all the majority of absorption of nutrients takes place. So with celiac disease, if we're having an autoimmune response from gluten, those villi they go away. They get inflamed, and they're it's really hard to absorb nutrients because we don't have all these little villi are all damaged. So potentially having some other like nutrient deficiencies like iron, calcium, vitamin D can also be a sign of celiac disease, because you're not able to absorb those things. So that's why sometimes with the lab tests, it can be one thing, but if you are having GI symptoms, it could be worth it to you can't see what's going on the inside from the outside, so getting a scope could be beneficial in seeing if there is inflammation and how the villi are looking. But with celiac disease, what is really nice is that those villi can come back and be healthy once again, and so you can get that absorption of those nutrients as your gut begins to heal. When the damage is done to the gut, but like continuously time and time over, that's where our risk for other complications related to celiac can happen.
Okay, so that's kind of being aware of not only the blood work, but how your body's actually physically feeling can be really important too, sounds like.
Yeah, and looking at some of the other potential labs, symptoms, signs, it can all be interrelated. And my thing is like, you know your body better than anyone else. I have multiple chronic conditions where I've been dismissed by doctors, and I'm like, what you're telling me and what I'm experiencing, like, they're not aligning here. So if you find that, you know, you feel like you have celiac disease, but you keep coming back negative, either advocate, find a different doctor if possible, or potentially making those changes yourself. And if you feel better, then you feel better.
Right.
But for the most part, in general, people with diabetes are at risk for celiac disease, but not everyone develops celiac.
Right.
Some people can develop a gluten intolerance, which is different. So there's like an intolerance, a gluten allergy, as well as celiac, and they're just all a bit different in terms of what body response is happening.
Okay.
So like if you're having an allergy, that's an allergy response. If you're having celiac, that's an autoimmune response. So it's different body symptoms that are getting activated.
Okay.
So same, but a little different.
Right. So is there the potential that if one doctor doesn't find anything, would there be the potential that another one would in that
It depends. I know for some doctors, if blood work doesn't come back, they're usually hesitant to do a scope because they're like, oh, if blood work's fine, why are we going to do anything, quote, more aggressive? Because if you are getting scope, you do have to go under anesthesia. So it is usually a small procedure to be done. But if that's something that would potentially give you a peace of mind, then that's also an option.
Yeah, I think that just really goes to show, like, advocating for yourself and saying, and I don't know, it's like a whole nother conversation, but I think that's like one thing that kind of like sucks is that like anticipatory, like feeling like, oh, I have to advocate for myself for everything that I might feel. Whole nother conversation that maybe we'll come back to on another episode. But all right, so just to recap, we have gone through the different labs that they might run for the diabetes end, heart disease, kidney disease, thyroid disease, and celiac disease. Now, with that, are there any other things that we should remain kind of on top of and aware of throughout the year while living with type 1 diabetes?
So if you go to your endo's office, normally they'll do some type of like foot check for neuropathy, essentially. So they'll have you like take your shoes off and kind of do, I'll just like touch your feet a little bit. And they'll sometimes do like the reflex test, and I always like giggle because I'll be like sitting on the edge and my endo will come and just like poke my knee, and my knee goes boop. So testing, doing feet checks. I don't do that. But foot care is also important. Dental exam. So diabetes can also impact your teeth. Puts us at a higher risk for cavities, which is lovely.
I got yelled at by my dentist for that about 2 months ago.
Yes. Cavities, gingivitis, we're also at risk for. So either like dental exams, dental cleanings, dental hygiene is also important. And this one hits home for me, but eye exams. Last year I had a little bit of a health scare with my eyes. I went to get just like my annual eye exam. I wear glasses, and there was a spot on my eye. And with that spot, the eye doctor was just like, I want you to go see a retina specialist considering like your health background. Let's just be safe. So it wasn't there the year prior, but it was new. So I went 2 weeks later to a retina specialist. He dilated my eyes, had me under really bright lights, and just kept going like this in my eyes. And for those 2 weeks, I was so scared. I was just like, I'm not even 30 years old, and I'm gonna go blind in my right eye. I cried when I came home from the doctors, and I was just so distraught because it felt like I did this to myself. And something that I want to share with all of you guys, because it gave me some reassurance, was when I went back to the doctor 2 weeks later for this retina specialist. He said if I didn't see your old pictures of my retina, he never would have assumed that there was a spot there to begin with. So in terms of like your retina, your lab work, any of these things, if you're maintaining your diabetes goals, it can help your body rebound or heal quicker in some regards. So he said it was a good sign that like it was there, but my body was able to also heal itself essentially. Something else that he also said that was really reassuring is in terms of any eyes on your retina, that some people have the same spot for 20, 30 years and it just stays the same. And on top of that, he said that when I come in and go for my annual exams, they're going to look for those spots. And if they find something, they'll do the same thing that they did. And they'll have me come in, do another check, see if it's there, and continue to monitor it to either see if it's getting smaller and what that progression is. And if it does change, at least we're aware that it's even there,
right?
Rather than if I haven't gotten my eyes checked last year. I mean, granted, it did go away and that's great, but what if I didn't get my eyes checked for like 10 years? Who knows what my eyes could be doing? So that for me was a big reality check because I haven't always been super consistent with getting my eyes checked or even going to the dentist. I personally hate the dentist. Like the noise of like them like, it's like nails on the chalkboard for me. But I thought that was like really important of just the best way to prevent complications is through the preventative care and going for these exams.
Yeah, and again, I think that's kind of like the mentality around it too. Like I think on one end, it can be really like it can cause a lot of anxiety and like it can be scary going to these appointments and, you know, constantly checking in on your health. But on the other end, it's kind of like, to me, it's a little bit reassuring of if I didn't have diabetes, chances are, like, when do you get blood work when you don't live with something like that? Like,
I think my fiance went to the doctor once last year and it was because he had an ear infection. He didn't even get blood work done.
Right. So like to me, yeah, it feels kind of
like that's crazy.
Right. We're checking in on these things and it's kind of nice to know where your body is and where those baselines are, and to know that you have the access to care that like is checking on these things for you and staying on top of it. So yeah, I think that's a really great reminder of like I didn't go to the dentist for like longer than I should have because of COVID, and then running out of no dental insurance. This year I finally got my dental insurance, have a few more cavities than I would like, had a $700 dental bill. You know, like I should have gone a long time ago to prevent that, but it was, again, that reality check of like my dentist told me like you should be coming at least every 6 months because like diabetes does add that complexity, but also like let's do the deep cleaning, let's like make sure that, you know, you're staying healthy and your teeth are staying healthy. And it does unfortunately have these bigger impacts, but you know, we can be on that preventative end to stay on top of it.
Absolutely.
All right, so I think that covers all of the questions that we have on the blood work end. I'm sure that everyone will have a million more questions that pop up and will probably DM you, but I want to go into a little bit about, you know, where everyone can find you, your personal practice, and what you support people with diabetes with.
So they can find me at t1d.nutritionist on Instagram or t1dnutritionist.com. I am in network with Aetna and United Healthcare, and hopefully soon Blue Cross Blue Shield. And I am licensed in most states to do one-on-one sessions with. And for the most part, majority of my clients are paying $0 out of pocket for sessions. So I am accepting new clients. So if you're interested in working with a dietitian for a number of different things, whether it's looking at your nutrition, going over blood sugars, or other health goals that you may have, you can shoot me a message, shoot me an email, and we can see if we're a good fit to work together.
I really hope you go in network with Blue Cross so then I can work with you. I don't know if that's
I'll
a
send you a
conflict.
bill.
Yeah. My favorite thing is whenever I send you these like lab reports, you like send a screenshot of Google. Or that was like one time. But thank you so much for coming on. I appreciate you, and I think this will be a really great episode for everybody.
Thanks for having me.